Hello everyone, how's it going? About 10% of people in the United States experience restless leg syndrome. Well, what causes it? Are there any home remedies that work? When should you reach out to your doctor? Well, if that sounds interesting to you, then keep watching. Now, restless leg syndrome, or RLS, is not life-threatening. However, it can affect a person's overall wellness. RLS is a brain, nerve, and sleep condition. Now, is it possible that a simple supplement has been overlooked that may help? Well, we're going to talk about that in a little bit. Restless leg syndrome, it typically occurs in the evening or at night when someone's sitting or lying down. They usually have a strong urge to move the legs. It's been described as crawling, pulling, tingling, itching, throbbing, aching, or even an electric feeling. It's not usually described as a muscle cramp or numbness. Now, it's usually felt in both feet or both legs. Moving, rubbing, or stretching, that may help temporarily. Now, restless leg syndrome can actually begin at any age, but it is more common after age 50. It's considered early onset if someone's diagnosed before age 40, and then it tends to progress slowly. It's considered late onset if someone's diagnosed after age 45, but it tends to progress more quickly. So what are the causes of restless leg syndrome? Well, often there's no known cause. Researchers suspect it may be an imbalance in the brain of a chemical called dopamine, which kind of makes sense because dopamine sends messages to control muscle movement. Now, for some people, it may be hereditary, especially when it's diagnosed before age 40. Oftentimes, it's something that you've inherited. Now, people experience restless leg syndrome during pregnancy sometimes, particularly in the third trimester. Now, experts believe it's due to hormonal changes that occur during pregnancy. Usually a few weeks after the baby's born, though, the symptoms tend to go away. Now, there are certain things that can make a person more likely to have restless leg syndrome. Being female is one of them. Having low iron levels. People who experience bleeding in the stomach or the bowels, they may have iron-deficiency anemia. Now, 4 out of 5 people who have restless leg syndrome, they also have a condition called periodic limb movement, and with this disorder, they experience involuntary nighttime leg twitching and jerking. Now, people also have peripheral neuropathy that could put them at more risk. Now, this is a condition where the nerves that surround the central nervous system, they've become damaged, like with the brain or the spinal cord. Some of the symptoms could include weakness in hands and feet, uncontrollable leg shaking, or discomfort in the limbs at night. Now, some common causes for peripheral neuropathy are type 2 diabetes, alcohol use, maybe an underlying autoimmune disease. Sometimes people have even gotten damage to the nerves after having anesthesia to the spinal cord. You've probably heard of a spinal block. Now, those who have Parkinson's disease and they take dopaminergic agonists, they also may be more at risk for experiencing restless leg syndrome symptoms. Those who have kidney failure, particularly those in stage 5, have an increased risk of having these symptoms. And this is one of the reasons is because people with kidney failure, they tend to have anemia. Now, there are certain medications that can make your symptoms worse. There are antidepressants, anti-nausea medications, psychiatric drugs, antihistamines, which people take for cold or allergy. Sometimes that can make the symptoms worse. There are certain foods that can also trigger the restless leg syndrome symptoms, such as candy, baked goods, ice cream, honey, all the good stuff, right? Also, for some people, caffeine can be a trigger. So coffee, tea, chocolate can bring on some symptoms. Also, alcohol, nicotine, or tobacco can cause someone to be more likely to experience these symptoms. So what are some of these home remedies that may actually help? What about that supplement I was talking about that may help some people with restless leg syndrome? And when should you go talk to your doctor? We're going to talk about that in just a minute. I'd just like to remind you to please like and subscribe if you're enjoying today's information. Also, I'd like to encourage you to check out the links below. You can read more information on this topic, and there'll be a few product suggestions there. Also, feel free to leave a comment down below if you have something you'd like to share on this topic. Okay, so what about these home remedies? Well, it's suggested to exercise moderately. Definitely no high intensity exercise that could actually make things worse. Try stretching your legs throughout the day, rubbing or massaging the legs before you go to bed. maybe taking a warm bath to relax the muscles. You can try alternating warm and cool packs. There are also compression foot wraps that some people find helpful. And there's a vibrating pad that you can try using. The vibrating pad can provide counter stimulation that may help mask the restless leg syndrome symptoms. And they actually are available by prescription. But you also could try purchasing something similar on Amazon. I'll leave a few links below you can check out. Now, some of these options may not be good for some people depending on your health and conditions, so you always want to check with your healthcare team to find out which ones would be safe for you. It may help if someone reduces or avoids caffeine, nicotine, alcohol, and stress. Now, if some of these suggestions are just not working, your restless leg syndrome symptoms are getting worse, interfering with your sleep, affecting your quality of life, it may be time for you to schedule an appointment with your doctor. Now, what about that simple supplement that I was talking about earlier? That supplement is iron. Now, we talked before about how people with low iron levels are more likely to have restless leg syndrome. So your doctor could order a blood test. If it's confirmed that your iron is low, the doctor can investigate why it's low. He may actually recommend that you try eating foods that are high in iron, like beef, chicken, spinach, iron-fortified breads and cereals. That may actually help improve anemia, which could reduce your restless leg syndrome symptoms. What I found interesting was that they said sometimes people have low iron in the brain, and then that could lead to restless leg syndrome symptoms. Unfortunately, doctors don't have a way to assess the iron in the brain other than brain imaging, which can obviously be very costly. So usually what they'll do is they'll do a blood test, and if your iron is low, the levels are low in the blood, and you're experiencing restless leg syndrome symptoms, they just kind of figure that it's likely that you are low in iron in the brain as well. So they may have you take an iron supplement, and that may help relieve your restless leg syndrome symptoms. Now, usually they'll have you start with just one tablet of 325 milligrams of ferrous sulfate one time a day. It works best if you take it on an empty stomach or you take it with some vitamin C. But if you do experience some stomach upset or constipation, you might have to try taking a tablet every other day. But work with your healthcare provider to find out what they would recommend for you to do. Now, while some people can just eat iron-rich foods and or take an iron supplement, there are some people who are just not able to tolerate the side effects of an iron supplement, or their gut may have trouble absorbing iron, or they may just have too low of iron for a supplement to even work. In that case, your doctor may actually recommend an iron infusion. So now, if low iron isn't the issue, and these other remedies are not working, your doctor may actually recommend some medications that could help increase dopamine in the brain, medications that are affecting calcium channels, muscle relaxants, sleep medications, and possibly even some opioids for pain and discomfort. Well, it may take a little bit of time, but your doctor should be able to find the right combination to help you get some relief from those symptoms. Now, it's interesting how some people's symptoms can be so mild, but others can have a very serious impact, where they have extreme daytime sleepiness. It affects their mood, their ability to concentrate. So it's nice to know that we have some treatment options available. Perhaps some of these home remedies will help, or maybe even something as simple as an iron supplement. But work with your healthcare team and make sure that they can get you so that you're getting a good night's sleep so that we can feel our best. Well, I hope you've enjoyed this information today, and I hope to see you in the next video where we'll discuss another way we can improve our health.